Practice ownership. Some state laws are more conducive to nurse practitioner practice ownership than others because of collaboration requirements or lack thereof and reimbursement practices. Nevertheless, NPs are starting their own practices, and many others have owned practices for over 25 years, hiring physicians where necessary to conform to the law. Those considering practice startup should be monitoring the state and national news to gain perspective on how their business ideas fit into their state's and nation's plan. There are advantages of practice ownership. Being the sole proprietor, the NP decides on the length of patient visits, decides on how the practice is run. The NP chooses his or her employees. The NP controls quality, controls referrals, and may titrate workload to income. And most of all, the NP keeps profits. There are several examples of NP practices: travel medicine clinics, pediatric primary care, wound care consultations, home visits, family health centers, urgent care, and even cosmetic procedures. There are barriers, and it's true that NPs have more obstacles to overcome than physicians when starting a practice. These include getting on commercial insurance panels, getting and keeping collaboration physician if required by state law, or billing Medicare, getting referrals from hospital emergency rooms, getting privileges at hospitals, and also the lack of legal authority to admit patients to nursing homes or home care and direct hospice services. There are several decisions to make before starting a practice, namely, with whom will I practice? There are advantages to both solo practice and group practice. There are many potential partners and many ways of aligning practices in addition to the traditional solo practitioner or group of practice of professionals where patients come to the office and providers collect from insurance companies. There are hospital-affiliated practices, nursing home-based practices, employer-affiliated practices, and agency-affiliated practice. Where will reimbursement come from? Well, it could come from any or all of 5 sources: government payers such as Medicaid and Medicare, private insurance. These private insurers include health maintenance organizations, managed care organizations, and indemnity insurers. Reimbursement may also come from patients who pay their own bills. They could come from contracts or even grants. The other decision to consider is will the reimbursement cover expenses? Many an employed nurse practitioner thought, if I were in charge, I would never run the practice like this. But before going too far with this line of thought, an NP considering opening a practice, and even an NP who expects to remain employed, needs to know how the numbers crunch in the business of primary care. It costs about $200,000 a year to run a primary care physician practice, not including physician compensation. There are several of these, a few of these including but not limited to rent, payroll, employee benefits, quarterly state and federal taxes, office equipment, telephone and internet connection, utilities are just a few of these. The other thing to consider is how will I get patients to come to the practice? And that's something really taken into account, because when an NP starts a new practice, as opposed to buying an established practice, he or she will need to bring in patients with whom the NP has already established a relationship or attract new patients. Either way, there's costs involved. I mean, there's marketing plans that you can do, advertising, and just creating an overall image. Through marketing the practice, potential patients learn what services it provides and the advantages of visiting. Another thing to consider is where will the practice be located? And you really have to take this into consideration, because the location of the practice will determine how easy or how difficult it is for the patients to come. If the patient base that the NP is looking for is using public transportation or traveling on foot, then the practice must be on a bus line or in a neighborhood. And if it's an inner city practice but the patients are coming by car, then convenient, inexpensive parking is a consideration. If a practice is looking for walk-in traffic, then a storefront location would be ideal, as opposed to a second-story office in a large building. Other decisions. If the state requires a collaborative agreement, how will that be handled? If a collaborative agreement is required by state law, a practice will need to find a collaborator before it opens. The first step is to find out what the state law requires in the way of physician collaboration. Is it a signature or a written agreement and an agreement to consult when necessary, or is it more involved, such as quarterly review of charts, co-signatures on charts and prescriptions, or monthly meetings? The second step is to make a list of possible collaborators. NPs will want to look for a collaborator who's competent, has a similar philosophy of patient care, will be accessible when necessary, and will do what is needed for a reasonable price. The third step is to discuss the NP's needs, the state's requirements, and fees with the potential collaborator. The fourth step is to weigh the potential contribution and expense of various possible collaborators. And the fifth step is to draft or have an attorney draft a professional services contract between the physician collaborator and the NP. If there are few willing and available collaborating physicians in the area, then the practice's longevity is threatened if a collaborator bows out after the practice is open. Also, to consider what sort of quality and productivity measures will the practice institute. If quality measures and systems to collect data on performance are set up at the time of the practice opens, then data collection will need to proceed from day one, and attention to quality will be built into the structure of the practice. Productivity directly affects income. So in a fee-for-service system of reimbursement, the more visits made and billed for, the more practice makes. How will patient flow be handled? From day one, there must be an agreed-upon way of setting up appointments, greeting patients, greeting insurance or other payment information, obtaining clinical intake information such as history, old records, chief complaint, vital signs, visiting the providers and arranging follow-up as needed. When making appointments, if appointment making software is available, then appointment books from supply stores would remain a good option. When taking in payment information, for each patient, the intake staff person will need to obtain the following information: name, address, telephone number, social security number, date of birth, method of payment. These method of payments could include insurance, cash, credit card, insurance company name, address, and telephone number, and a copy of the insurance card. And last but not least, emergency contact name, address, and telephone number. Another consideration is, will the practice use an electronic medical record, and if so, well, which one? Given the advantages of EHRs and the trend in that direction, it makes sense for a brand new practice to begin with an electronic record. To answer the question of which record is best, just start with articles in a medical trade journal about the top electronic records, make inquiries, and then comparison shop. Ask other practice owners about pros and cons of their systems. Or a practitioner could start with paper records and then just transfer the information to an electronic record later. That's a major undertaking, however. And where will I get malpractice insurance? Well, there's several companies that offer professional liability insurance to NPs. Their policies and premiums change from time to time, so the new practice owner will need to inquire about coverage, limits, and requirements about 30 to 60 days before opening. A practice owner will want a policy that covers not only NP practice owner, but also any other staff or clinicians working there. Some of the questions that you would want to ask an insurer is your policy occurrence or claims made? Occurrence is always preferable. Will the policy cover me and my employees? Will the policy cover physician if physician collaboration is required in the state? What are the policy exclusions? What are the limits? May I read the policy before purchasing the insurance? Does the policy cover license, defense, or any other expenses in addition to damages for malpractice and legal expenses? And of course, what is the premium?